Welcome to the 2023 opening session and keynote speaker. Please welcome National League for Nursing Chair, Dr. Kathleen Poindexter, and President and CEO, Dr. Beverly Malone.
Welcome, everyone. On behalf of the Board of Governors and staff of the National League for Nursing, welcome to the 2023 National League for Nursing Education Summit. Our theme this year is extraordinary nurse educators leading in extraordinary times. We are so pleased to see so many extraordinary nurse educators joining us this year. Not done yet. This is definitely an extraordinary time we are living in, especially since we can see on the news almost daily the significant threats of climate change to human health and equity.
Colleagues, with that in mind, I'm pleased to introduce our extraordinary keynote speaker, Dr. Victor Dzau, President of the National Academy of Medicine. We could make him a nurse, colleagues, or NAM. He is recognized globally for a long and highly decorated career as a scientist, administrator, and leader. In addition to his many, many accomplishments, under his leadership, NAM launched a grand challenge in climate change and health, aimed at mobilizing the biomedical community to drive change through research, communication, and policy, and taking actions to decarbonize the health sector. He is with us today to discuss NAM's commitment and initiative to providing climate change solutions and the role of nurses and nurse educators in addressing the climate crisis. Colleagues, please give a warm welcome to Dr. Victor Dzau.
Well, good afternoon. Good afternoon. All right, thank you. Extraordinary nurses and extraordinary leaders. What a great pleasure and honor for me to open your meeting. I recognize that you had to do a little accommodating my schedule, but thank you so much. And I was really looking forward to this. You know, as you hear, climate change is an existential threat. It's the #1 issue that we should all be thinking about that will actually affect not only us now, but our future generations. So I'm asking all of us, especially the nursing community, to work with us to go forward and address this major issue. Before I begin, what I'd like to do is to just give you one slide to tell you about the National Academy of Medicine in case you're not aware of this. Suffice to say that we were founded as part of the National Academy of Science, which was in fact chartered in 1863 by Abraham Lincoln and Congress, as an independent body to advise the government, in this case during Civil War, on issues which are science and of course now health and medicine, independent, evidence-based. Now, they were very wise to create an academy such as this. And of course, over the years, we've done tremendous amount of great work since 1970, and now we have, in fact, called ourselves National Academy of Medicine. Now, I feel I owe you an explanation, because obviously we should think about National Academy of Health and not medicine only. But when we were just changing our name, there was a lot of pushback about National Institute of Health. So the confusion between NIH and NAH, and hence is what we are. But I see the term medicine is broad. It's not the medical profession. It is the practice of healthcare, and hence it's so wonderful to have you. Let me talk to you first about how important you are to the Academy. We have about 100 nurse members who in fact play a critically important role. For example, in the governing board called Council, Linda McCauley is on the board, and of course, she's a phenomenal leader in this area. The membership committee, we have nurse leaders on membership committee. We have nurse leaders in many committees, and of course, in the collaborative, such as I talk about today in climate, where Dr. Beverly Malone plays an important role in steering committee, and I'll say some more about this. We have, as you know, one of our most downloaded report ever, Impact is the Future of Nursing. And we did that in 2010, and then we did that in about 2021, 10 years later. And this recent report on primary care had Linda McCauley again co-leading this, in which nurses play a critically important issue. What am I saying? I think you guys are extraordinary, and you play such an important role in the health and healthcare of our nation. You play such an important role for the NAM in order for it to do its work. And then, of course, your President, Beth Malone, I call my membership director and say, you know, I'm going to be seeing Beth. She said, oh, she's so wonderful. Can you make sure people know that? Well, you know, she is, in fact, playing a critically important role, not only in this climate project, but also in the burnout, in our clinician burnout, which has the nurses and physicians and all health professions together address this issue. Beth plays a critical role, as Prem Cipriani and many others on this. So all I'm saying is that we need more of you. Thank you very much for doing such great work. And I mean it. I really mean it, not because I'm speaking to this group. I truly mean this. Now, climate change. Of course, we all saw what happened this summer, the wildfires in California, the extreme heat everywhere in the United States, the hurricanes and floods everywhere in the United States, and of course, globally, we're seeing horrific devastation from air pollution, extreme heat, extreme weather events, flood, drought and famine, and of course, vector-borne disease and climate migrants, forcing people to be refugees everywhere. Just in this slide in the United States, you can see it's impacting the United States everywhere. And I have some statistics here. Suffice to say, about 200,000 deaths a year from climate-related events in the United States. And the human toll is huge, because when people think about climate, I always have this visual image of a polar bear in the shrinking slab of ice. But the image should be us people, lives, death, suffering, and human, damages and tolls. The economic toll, as you can see in the 2021 report, is about $820 billion annually for the United States. This is a big, big issue. Now, you all know that it doesn't affect everybody equally. This slide just simply shows you that the risk is unequal, the impact is unequal. It's an issue of equity. In fact, while you're looking at older adults being affected by extreme heat, we all know this, and you see them in emergency rooms, and the younger children being affected by air pollution and many other issues. But I think the communities of color, the socioeconomic challenged communities, the marginalized communities are the ones who actually suffer most, because they're the recipient of the carbon emission from industry, and if you look at globally, 1% of the richest country emit 2 to 3 times more than 50% of the poor countries. And of course, the impact is huge because these communities are not as well prepared. They don't have the resources. And many people in the United States may not have health insurance. And you can imagine the impact is huge. So climate change is not only a public health crisis, it's an equity crisis. Now, I don't have a lot of time, so I want to focus on what our role is, what your role is. When you think about what's happening in climate change, the extreme events, you work in the emergency room, you work in the hospital, you work in outpatient, you know that there is a huge amount of people coming to the emergency room during extreme heat. But if you think about the extreme events such as flood and others, think about hurricanes, the amount of care needed to give to this emergency is huge, and frequently it puts the tremendous demand of our system. I always think about the image of Katrina. Remember Katrina, where people really are, the hospitals are destroyed, people are climbing on the roofs, you know, all that stuff. What that means is that we have to be much better prepared, and we have to help the communities to be more resilient. This is why I think nurses play such an important role, because you work so much closer to the patients and the communities. But I also want to point out, aside from our role as care providers, we actually are culprit in climate change. In the United States, health sector emits 8.5% of total carbon emissions. That's huge. That's bigger than a lot of other industry. And the reason that we emit so much, aside from the fact that in hospitals, we have high energy, consuming technologies, you name it, but also that people have to drive to clinics and hospitals to see the healthcare providers, but also the way that we practice medicine, the amount of waste we have. Think about this, how many disposables, and the fact that these disposables are contributing to climate change. Anesthesia gases contributing to greenhouse emissions, so we need to change the way we practice as well. But also in scope 1, 2, and 3, it's also scope 3. 1 and 2 is what we do, but scope 3 is related to supply chain, manufacturing, and it's what we purchase. So we have a role to think about how to actually put pressure on the industry to reduce their carbon emission, particularly when you think about supply chain, transportation, you name it. It's estimated that the damage from US health pollution is in the same order of magnitude as preventable medical errors, and that's huge. So if you look at what US does, and we're happy to lead the world in things, but not in this one, 25% of global sector emissions come from the United States. So what's our responsibility? First of all, I think we need to tell the world that this is a public health crisis, equity crisis. Many people, as I said, imagine this as an environmental problem for the future, but they're not quite aware this is affecting their health and affecting health of others. So if we communicate to the public, and now the good news is more and more people are now more aware of this, then suddenly they realize the threat is right now, is on their health and in their lives and in their sufferings. So we have a strong voice to talk about communication. Second, of course, we need to do everything we can to reduce climate change impact and improve health for all, particularly looking at the climate health disparities. Third is, as I said, being ready to prepare for emergencies, build a health system and resilience, and particularly in marginalized communities and populations. Fourth is do no harm. We all take this oath. And if we're emitting 8.5% of greenhouse gas, we should be actually doing everything we can as a sector to reduce that carbon emission. And finally, of course, I think about patient safety and quality. When the same issue happened some 20 years ago, and we mobilized everyone, and nurses play such an important role in research and innovation. So look at this data. Despite all this now rhetoric about experts, scientists, public health, you name it, we still remain to be the most trusted profession. This study shows you, and it's a recent study, that still nurses, number one, physicians, number two, are the most trusted profession by the public. So I feel that our profession has a role to communicate, to tell the patients, to tell everybody of this problem, but also responsibility to care for climate-related illness, health system resilience, and reduction in carbon emission. Now, you play an especially important role because you comprise 20% of health professions worldwide, and you're particularly trusted. Accessible, responsive, compassionate, and often the first provider people meet when they seek care, when they come into a system. And you often work with people who are underserved, marginalized, and at most risk on the impact of climate change. So it's very clear that nurses are playing an important role, practice, education, research to become the agents of change. Now, back in 1995, when we were still the Institute of Medicine, IOM, actually wrote a report about nursing, environment, and climate change. We say nurses are often at front lines in confronting environmental health hazards. And of course, the idea is you're well positioned to address environmental health. Today, what we say is nurses must communicate, educate, and take actions to address climate change health impacts. As written by Butterfield and others, they say, your collective potential to change the trajectory to climate action is unparalleled. There's no question about this. I would say unparalleled in any other profession. Now, how do we come in? As National Academy of Medicine, we do have a great reputation as an evidence-based organization, as a convener. And so we are the neutral, independent, evidence-based convener. We can bring together everybody to work together. We have a great network of health professions and outside the profession, and we're a trusted messenger, like all of you. So for that reason, in 2020, we said we got to think about what we can do in this issue, and we created a planning group, about 70 to 100, that worked for about 6 months to plan what we can do forward. And our conclusion is that we should launch a grand challenge. Now, what's a grand challenge? It's taking the highest, the most challenging issue, but to be bold and audacious goals, to say, let's bring everybody together to address this issue. So we, in fact, have launched this in 2020, and it's chaired by Dr. Judy Roden, the former president of Rockefeller Foundation. We have come together some 180, 200 experts with different diverse sections and disciplines, and there's a true public-private collaboration. For example, the Assistant Secretary of Health, Rachel Levine, and the Office of Climate Change and Health Equity is working with us. She's a co-chair of the Action Collaborative. We partner with industry, bring them together, say, we all need to work together. You need to change the way you practice. We partner with academia. We partner with your profession. We have 5 strategic objectives, and I'll show you the next slide. One is messaging, communication, and we're working with professional communicators to look at how to push this out, but also we're working with education of all professions, and Beth plays a key role in this, which I'll talk about in a few minutes, to actually make sure that the curriculum is updated. What are the gaps? What do you need to teach? And all health professions are able to know about this, practice mitigation of climate change, and also communicate. Second one is a roadmap, because we recognize it's not only health sector, food, agriculture, transportation, I talked about, energy, all affect climate change, affect human health. So we want to bring all these sectors together to say, how can we work together with a lens on human health and well-being? Research innovation, but I want to highlight the third one here, which is decarbonize the health sector. We believe that we should mobilize the entire health sector in the United States to work together to decarbonize our sector so that we can greatly reduce the emission and therefore begin to make a difference. And finally, we're going to create, across this, an equity lens, which I'll talk about. So the equity is the creation of a network of communities which are greatly affected by climate change. We work at the University of Maryland, Jacoby Wilson, where we have, in fact, we have a map, a heat map, to look at all the communities in the United States which have the greatest impact of climate change and also socio-economic challenge. We bring these lived experience and voices together and bring along experts such as foundations, the DHHS, Department of DPA, and also academia and others, so that we can co-design, listen to what's needed in community, co-design solutions, and try ways to improve the community situations. In the health sector, we have a combination of public-private partnership. You can see Rachel Levine, Assistant Secretary, co-chairs with me, along with, in fact, United Health, the large insurance, and Cardinal Health, the supply chain, that we can all work together. So the members represent hospital systems, clinicians, payers, distributors, pharmaceutical companies, health profession, academia, nonprofits, and federal government. We organize ourselves into a steering committee, which Bev Malone sits on, and these 4 working groups. How do we work on the middle, healthcare delivery? Along with you who are involved with healthcare delivery, how can we mobilize healthcare delivery like we did with patient safety and quality and start making changes? How do we look at professional education on the right side of the slide, in which Beth actually co-chairs this working group, along with David Scotton, the president of Double AMC, Medical College Nursing together, and with Erin Bernstein, who's now the CDC Director of Environmental Section. And they hard at work to look at what's needed, what are the gaps in curriculum, et cetera. And healthcare supply chain, to get the supply chain also to change. And then we have a committee, the working group on finance, policy, and metrics, with Don Berwick, Les Fowler from CCMI, and John Perlin, the head of Joint Commission. We're looking at what do we need to do to provide support, incentive policy to help hospitals and others to work in this. And we have a large network of organizations who work with us. So to cut the long story short, you can see they have been busy at work for the last 2 years, looking at making a case for decarbonization for the health system. Because after all, think about where you work. Many of you work in health systems. The CEOs say, we are just overwhelmed with, now shortages of nursing. We just came up from COVID. We're losing money. Do I need to do something else? So we want to make the case to show them it's good for healthcare. It's good for health, but also in the long run, it saves money. Also, so we are providing a lot of this kind of products. Education, we talk about leadership in terms of looking at a primer for decarbonization. What do education systems need? Policy, we talk about, we have these carbon clinics that we hold for people to join, and regulatory agenda papers, and supply chain. They create a journey map which all supply chain can say, if we want to join this, how do we do this? And begin to get the journey. Where we are is on January 2024, we're going to launch a national movement. Just like the patient safety issue, some of you remember the 100,000 Lives campaign that Don Berwick put forward, in which we say we're going to save 100,000 lives from medical errors. With Don's help, we are going to launch a similar issue for climate, getting as many people joined as possible, and it's a long journey. But look where we are now in patient safety and quality. We hope we can do that. This is where you come in. First of all, you know, when we look back on the 100,000 Lives movement, nurses play a critically important role. And so we want to use that as a model. And of course, as I said, Bev and others, and there are about 6 nurses who's involved with the collaborative, and I want more of you to be involved with, look at education, look at where we need to go. You know, I was a CEO of Duke University Health System. I can tell you without any hesitation that the patient safety movement in our hospital system was really driven by nurses. And our chief safety officer, Karen Fresh, is a nurse. And every year we have hundreds of nurses coming together, as is doctors and others, to look at, you know, retreat sessions, posters about things we're doing. I think we can do the same in the climate area. Education. We have a climate education leaders convening, which in fact, you are so important in bringing together the other health professions. And upcoming nurse leaders are really developing guidebooks designed to commit to any nurse organization to how to start their decarbonization journey. Now, I look at this amazing organization, the National League of Nursing, and you had a vision statement in 2022, climate change and health, and it's very clear what your vision statement is. Nurse educators must prepare future nurses to address climate change-related illnesses and emerging patient care needs in the era of our climate-changing world. These are indeed extraordinary times. They're extraordinarily great, but they're also extraordinarily challenging. This is one of the biggest challenges. For deans, directors, and chairs of nursing programs, lead nationally and globally, develop a strategic plan, ensure that nursing curricula address social, structural, and environmental determinants of health. For its faculty, engage students in how to address this important issue. There's such an important voice: mitigation, adaptation, and resilience. And then, of course, policy and advocacy that you do so well, support equitable recovery from climate events, and to decrease the need for downstream healthcare responses, and advocate for disaster planning and prep. Well, guess what? Just this last week, the ANA came out with a position statement, very similar to NLN, and it says, climate change, climate justice, and health. Nurses are a source of hope, skilled systems thinkers as relation experts. So in professional settings, we need to do education advocacy in public policy, advocate for the right policy, and through nursing organizations such as this, educate others, have grassroots movement. So I'm asking you today to join us in this effort. Already you are playing a leadership role, but more of you, grassroots effort, I think we can make a difference. Thank you very much.
Thank you, Dr. Dzau. We really appreciate your timely, impactful words on such a vital issue, colleagues. It's amazing that he was able to take time out on his way to Montreal to come by to say these important words to the National League for Nursing. So, safe travels, Dr. Dzau. Kathleen.
Wow, those were some pretty profound messages. Give you pause to think. Now, as I was saying earlier, as you can see, these are indeed extraordinary times, and there is an urgent need in nursing education to address the impact of not just climate change, but also of structural racism, income inequality, technological innovations, not to mention disparities in education mental health issues, burnout, and health inequity. Colleagues, it can often seem like a lot and maybe too overwhelming. But as nurse educators, we know that we can bring an intentional lens on systems and structures for meaningful and lasting transformation. For generations, influential thinkers and so many unsung heroes have taught, envisioned, and led nursing education in extraordinary times. With the NLN core values of caring, diversity and inclusion, integrity, and excellence, today's nurse educators lead and promote innovations in teaching and learning, practice, policy, and research that celebrate the whole person and value new perspectives. Having demonstrated exceptional flexibility, adaptability, and courage, especially during the COVID-19 pandemic, nurse educators continue to be called upon to engage local, national, and global communities, inspire others to act, and to build partnerships that co-create health equity and social justice. That is why this annual summit is so important and why we're so glad to have every one of you here. You are the change makers and the leaders who will transform not just nursing, but overall public health. And speaking of transformational leaders, it is now my honor to recognize the members of the NLN Board of Governors whose insights and wisdom are truly significant and appreciated. I cannot say it so much as I'm so thankful for my colleagues. Please stand as I call your names. My dear colleague, NLN Chair-elect Patricia Sharpnick, Breen School of Nursing and Health Professions, Ursuline College. Secretary Tidra Smith, University of Alabama at Birmingham School of Nursing. Treasurer Ann Krause, Widener University School of Nursing. The Board of Governors, Audrey Bouvet, Egan School of Nursing and Health Studies, Fairfield University. Majidel Albana, George Washington University School of Nursing. Yolanda Van Riel, North Carolina Central University. Michael Newsom, Research Virginia Commonwealth University School of Nursing. And Mark Vogt, Galen College of Nursing. And the following colleagues sent their regrets that they could not join us this year due to discrepancies in their schedule. But Rachel Reisner, Frontier Nursing University. Walter Bumpus, American Association of Community Colleges, and Cheryl Hoying, Kirby Bates University of Cincinnati. Thank you for your dedication, your time, your loyalty, and your service to continue to advance the mission of NLN and represent the membership of this organization. Thank you. I would also like to acknowledge our past NLN presidents. They are Rumey Alexander, Kathleen Schultz, Antoinette Bergliotti, Nancy Langston, Sheila Ryan, Jean Watson, Carol Lindman, Claire Fagan, Patty Hawken, and Sister Rosemarie Donnelly. These are all past presidents, the giants that led, that had the vision and the bold ingenuity to continue to advance this organization. Now, I would like to recognize the presidents who are here with us today. And when I call your name, please join me on the stage. First, my dear colleague and predecessor, Patricia Yoder-Wise. Next, Anne Bevere. Marcia Hall Adams. And Elaine Tagliarini. We all want to recognize and thank you for your outstanding service in support of the NLN and of nursing education. We cannot thank you enough. Oh. Now this is terrible. Judy Halstead, please. Oh my goodness. I want to say, we even recognized that that was missing. I need you. I just want to say, these people, I would have never imagined myself here. These people are those that I've looked up to for so long in my career, and I can't imagine that any one of you have not followed every one of their contributions to nursing education, advancing the science for both in our practice. So it is a sincere thank you. You had big shoes for me to stand in, that's for sure. Now, I am going to turn it back over to our President and CEO, Dr. Beverly Malone. She's going to recognize some valued supporters who have made this year's summit possible. Thank you.
Thank you very much, Madam. Colleagues, we thank you again for joining us this year. We're so appreciative to have you back meeting in the Washington, D.C. area, where so many decisions of national importance get made, and some don't. Well, we won't talk about that. And we couldn't have pulled off this year's summit without our sponsors. We owe them a big thank you. Please wait until we have acknowledged all of our sponsors before your applause. We first thank Chamberlain University and Walden University for being our platinum sponsors for this year's summit. In particular, they are sponsoring our opening reception, which takes place right after this session in the exhibit hall, and our prestigious closing gala and reception on Saturday night, which follows the honors convocation. We next thank Laerdal Medical and Galen College of Nursing for being our diamond sponsors. Long-term and long-time sponsor Duquesne University School of Nursing is once again supporting the summit at the silver level. Our Friday coffee break is brought to you by our bronze sponsor, Western Governors University. And we have 3 excellent sponsors at our supporter level: UNC Greensboro School of Nursing, Indiana University School of Nursing, and the Peace Corps Response Program Advancing Health Professionals. Please be sure to stop by our sponsors' booths and learn about the important work they are doing for nursing education. They are listed in the exhibitor directory you received during registration or in the Summit app. Thank you all for all your support of the Summit and of the NLN. Let's now have a big round of applause for our sponsors. Next, on behalf of the NLN Foundation for Nursing Education and Chair Patrick Robinson, we extend our deepest thanks, as we always do, to all those who have contributed to the foundation throughout the year. Special thanks to the NLN Foundation Advisory Council, which includes Kate Campbell of TrueLearn, Karen Cox of Chamberlain University, Robbie Craven of F.A. Davis, Alf Christian Diebdahl of Laerdal Medical, Cole Edmondson of AMN Healthcare, Tim Iman of LifeWork Education, Elaine Foster of Education Affiliates, Renil Harath of Healthcare at Emeritus, Mary Jo Jurdy of United Health Group, Natalie Jones of ProLink, Rhonda Laws of Lecturio, Ken Lefkowitz of Hughes, Hubbard, and Reed, LLP, Andrew Lingo of Health Carousel, Nick Mansour of Arizona College, Matt Marino of Education Management Solutions, James Quick of Simplify, Mikkel Snyder of Nightingale College, Janet Smith-Hill of SSM Health, David Theobald of Davin Healthcare, Ward Ulmer of West Coast University, Mark Voigt of Galen College of Nursing, and Abdel Yosef of Unitech College, plus 2 members who have chosen to remain anonymous. I would also like to thank them for their support, the 2023 NLN Academy class, and the 2023 NLN Centers of Excellence, and all benefactors of the NLN Foundation Summit. Thank you all. You can check that out in the lobby. We would like to thank our generous partners and sponsors for the following initiatives: NLN Chamberlain University College of Nursing Center for the Advancement of the Science of Nursing Education, Dr. Karen Cox, President; NLN Walden University College of Nursing Institute for Social Determinants of Health and Social Change, Dr. Sue Subak, Chief Academic Officer; Dr. Andrea Lindell, Vice Provost, College of Health Professions, and Vice Provost and Dean for the College of Nursing; and Matthew Reed, Interim Director, Healthcare East Division, Walden University. NLN J&J Project, transitioning senior nursing students in historically Black colleges and universities, schools of nursing into clinical practice. Johnson & Johnson, our Race for Equity, Shalina Ramadreen, Director, and Frank Rodriguez, Global Leader. NLN Leadership Institute, Galen College of Nursing, Mark Voigt, CEO. Their support for the NLN and for their continued commitment to making a difference in nursing education has been simply outstanding. We celebrate them and their contributions. Let's give them another big round of applause. Also, I'd like to offer a special welcome to Carrie Nunn Ellison, Director at the Accreditation Commission for Education and Nursing, or ACEN, and Dr. Francis Gerbasi, CEO of the Council on Accreditation of Nurse Anesthesia Educational Programs. They're both joining us this year for this celebration. Let's give another welcome to Laerdal Medical and Tor Laerdal founder and Alf Christian CEO, who are also with us at the summit. Please stand and be acknowledged, colleagues. Next, I would like to take a moment of personal privilege and offer my congratulations to 2 LNN superstars. Dr. Janice Brewington, Chief Program Officer, designated as a living legend by the American Academy of Nursing, and Dr. Larry Simmons, Senior Director of Credentialing, selected as a fellow by the Academy. Colleagues, join me in applause for them. Please stand, Janice and Larry. Finally, I would like to thank everyone who is considering making a donation, as well as those who will make a donation. I think the act is even better than the consideration. To the NLN Foundation during the summit. You can find ways to give online through the Summit app. And now let me turn it back over into the competent hands of my colleague and chair, Kathleen Poindexter.
And I'll pause just in case you're trying to use that phone for that Summit app that you can find on there. No. I too really would like to thank the many people who generously give of their time, energy, and talent to support the goals and mission of the National League for Nursing. A sincere thank you all. Now, I am pleased to recognize two extraordinary NLN President's Award winners this year. The NLN President's Award honors leaders in healthcare who are bright, shining examples of the NLN core values of caring, integrity, and diversity, and inclusion, and of course, excellence. These individuals who have dedicated their life's work to advancing the health of the nation and the global community. Both of this year's winners are distinguished faculty at the MGH Institute of Health Professions. They include a former NLN president and community health advocate and a scholar in healthcare simulation. Let's start with the simulation scholar and renowned leader in the specialized field of simulation in healthcare. Dr. Susan, or as some of us call her Susie, Carden Angren, was a consultant to the landmark National Council of State Boards of Nursing National Simulation Study. The study determined that as much as 50% of traditional clinical preparation could be effectively transmitted through high-quality simulation instruction. In 2010, she was also chosen to deliver the Deborah L. Spunt Lecture at the NLN Education Summit, which also serves as a showcase for leading simulation scholars to present their latest evidence-based findings and perspective to a broad audience of educators. The Society for Simulation in Healthcare also awarded her one of its coveted speaking opportunities, the Michael Gordon Lectureship in Simulation. Dr. Agren has more than 140 publications to her credit and is in high demand on the international speaking circuit in simulation education. She served as the editor-in-chief of the journal Clinical Simulation in Nursing for 10 years and is currently editor-in-chief of 2 new interactive online review guides for candidates seeking certification in the Society for Simulation in Healthcare. Dr. Agren served as chair of the research committee for the Society for Simulation in Healthcare and as vice president of research and president of the International Nursing Association of Clinical Simulation in Nursing, also known as ANACSO. She is a fellow in the Society of Simulation in Healthcare, the NLN Academy of Nursing Education, and the American Academy of Nursing. Dr. Agren is a senior fellow at the Center for Medical Simulation in Boston and an associate professor at MGH Institute of Health Professions, also in Boston. Please join me in welcoming President Award winner, Dr. Susie Carlin-Engren. Such an honor, huh? And I know many of us have learned so much from her. Okay, now we move on to our next. On behalf of the NLN board and the entire NLN family, again, congratulations, Susie. Now, I get the privilege and the honor of introducing our second President Award winner, Elaine Tagliani. Elaine served as president of the National League for Nursing as the chair's position was then called from 2007 to 2009. And following that, joined the NLN senior management team as chief program officer through 2017. Today, a professor at the School of Nursing at the MGH Institute of Health Professions. Earlier in her career, Dr. Tagliani spent more than 25 years as a professor of nursing and Independence Foundation chair in community health nursing at the Community College of Philadelphia. With her long history of organizational leadership and grant-funded initiatives, she has worked through national channels to support models that foster academic progression of nursing graduates across the spectrum of higher education and provide patient-centered care for older adults and their caregivers. During her time with the NLN, she pioneered the development and dissemination of the Advancing Care Excellence Professional Development Resources, also known as ACE, that helped nurture an important collaboration between the NLN and the Independence Foundation. Subsequent funding by the Hartford Foundation, the Hearst Foundations, and Laerdal Medical resulted in the adoption of ACE curriculum case studies and teaching strategies by nursing programs nationally and across the globe. The program has grown into one of NLN's signature initiatives to provide culturally humble, equitable, and accessible care to a range of vulnerable population sectors. Her devoted leadership of the NLN Archives Project in collaboration with the Barbara Bates Center for the History of Nursing at the University of Pennsylvania preserves NLN's rich history in an archival repository for scholarly historical research. This initiative reflects Dr. Tagliani's dedication and commitment to the NLN and to nursing worldwide. In addition to receiving the President's Award, Dr. Tagliani will also be inducted during the honors convocation into the 2023 class of fellows in the NLN Academy of Nursing Education, which was established in 2007 while she was the president-elect of the NLN. Again, please join me in welcoming President's Award winner, Dr. Elaine Tagliani.
Awards are given to one person. There's a certain irony in that, colleagues, because this one person is receiving this award today thanks to so many others who have mentored, coached, and supported me in my long journey as a nurse educator. I am so touched to receive this Lifetime Achievement Award from the NLN because the NLN has really been my professional home for over 40 years. I attended my first meeting in 1979 before most of you were even born. And like all of you who stand pedagogically in life as teachers, like you, we are all committed to the NLN mission, dedicated to excellence in nursing education, striving to improve the health of our nation and the global community. I am so proud also to be part of the NLN Archives Project because the history of our NLN is the history of nursing education in the United States. And it's such a profound history full of extraordinary leadership and transformative strategies as the NLN continues today. I am so grateful for this award, Kathleen. Thank you to you and to the NLN Board of Governors. Thank you to Bev and the NLN leadership, to my family, and certainly to the hundreds of colleagues I have known so well over the past many years in the NLN, relationships that I cherish to this day. You are my heart and have always been, and thank you.
I just want to say thank you again. And before I turn this back to Bev, I just want to recognize if it wasn't for the work of Dr. Susie Carden-Ingren and Dr. Teglerini for their ACE and their simulation, could you imagine where all of us would have been during COVID? How much they contributed to us and gave us the resources to keep our nursing education going. So, again, thank you so much.
Congratulations again to Susie and Elaine for the well-deserved recognition as NLN President's Award winners. And thank you, as always, to our esteemed NLN Chair, Dr. Kathleen Poindexter, and the entire Board of Governors. Now, I have just a few important announcements as we conclude today's opening session. Last week, you were emailed a Navigating the Summit info packet. The packet contained a lot of helpful information. Perhaps most importantly to you, information related to receiving your CEUs. As you should have already read and experienced, you must scan your badge prior to entering every session. May I repeat that? You must scan your badge prior to entering every session. To receive credit, you've given a 10-minute grace period at the start of each session to scan your badge. Colleagues, you will not be able to scan your badge at the end of the session. Additionally, only scan your badge one time per session. Just listen for the beep. Scanning your badge twice will invalidate the scan, and you will not be listed. No, 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 no. In the attendance list to receive your CEUs, those precious things that relate to your license. This goes for both the concurrent sessions and selected general sessions held in this room. The NLN is unable to retroactively scan you into a session, so don't forget. Okay now, repeat after me. I promise to scan my badge prior to entering every session. That's right, I promise to scan my badge prior to entering every session. Very good, very good. Now the part two. I promise to only scan my badge one time per session. Let me hear you. I promise to scan my badge one time per session. Oh my goodness, you might end up being educators. Very good, colleagues. And again, thank you so very much. Now, this is important because your unique CEU evaluation will be tied to the sessions for which you scanned yourself in. You will receive an email following the summit with a link to complete your online evaluation and download your certificate. You will have 60 days to complete this process to receive credit for the summit. So please complete it right away. After the 60th day, you won't remember it anyway. Also, if you haven't already done so, please download the NLN Summit mobile app, sponsored by Biomedical. Just search for NLN events in your App Store or Apple Store or Google Play. With this app, you can stay up to date with the latest announcements, find your way around the summit schedule, and engage with other attendees through the social wall. Finally, it's not too soon to start planning for next year. The NLN 2024 Education Summit will be held on September 18th through 20th at the Marriott River Center in San Antonio, Texas. The 2024 theme is, and you're going to be the first group to ever hear this publicly, a daring proposition, competency-based education. Information about abstracts will be on our website soon, so start making your plans now. Colleagues, I want you to remember that you are valued members of the NLN community, and that we want you to have a wonderful summit experience. And now it's time for the opening reception, exhibits, and posters. Thank you again to our sponsors, Chamberlain University and Walden University, for sponsoring this kickoff reception. I look forward to seeing you there. Thank you so much.
Let's go. Your time is running out.